Has anyone heard of a dermatologist prescribing a bleach bath? Bleach! Hey y'all, I'm Amani and I am a self-proclaimed skincare expert.
And I'm Zack. I'm an actual dermatology provider at Curology.
I mean, I guess actual.
Yeah.
But today we're going to be diving super deep into the Reddit skincare questions and comments today.
Yeah, I'm looking forward to it. Let's do it.
Let's do it. So I've been scrolling on Reddit and I've been seeing some derms comment some really wild skincare advice. And I'm just like, I don't think that people should be following along with this advice. So we need the expertise from you to let us know the real tea and the real scoop on what we should be doing with our skin.
All right, I think I'm ready for it. Let's see what you're looking up here.
So for the first post, my derm told me to ditch the moisturizer. Now I know for all us glow goddesses out there, moisturizing is key. So this person has persistent acne and they have tried everything for their skin and their derm prescribed them Epiduo Forte and their derm also told them to stop moisturizing. I'm not comprehending, but first, what is Epiduo Forte?
Epiduo Forte is a great topical medication. Okay. It's actually a combination medication, so it has differin gel, which is really good for acne. Okay. And then it also has benzoyl peroxide as an ingredient, which is also great for acne. The problem is they're both pretty drying, so when you put them both together in one product and put it on your face, your skin can get dried up pretty quickly. Okay. If that happens, dryness can tee you up for a breakout because it can cause some inflammation, irritate your skin barrier. Yeah. So it's a little tricky to say, start an Epiduo Forte and not moisturize. I definitely think moisturizing is a good option, especially with this treatment.
Exactly, to my point, we need to moisturize for this glowing skin, but hold on.
Okay.
I was looking at the comments and one commenter said, I get pimples if I use moisturizer more than 2 days in a row every time.
All right, I can actually believe it. There's a lot of moisturizing products on the market. If you happen to pick one with a pore clogging ingredient though, you could tee yourself up for breakouts. So simple ingredients like coconut oil, it sounds fantastic, but it's really pore clogging and will definitely lead to breakouts. And other ingredients like sodium lauryl sulfate. So just do a little research whenever you're picking your moisturizer. I think it's really important and can make a big difference.
Okay, so bottom line, no coconut oil.
No coconut oil,
Period,
please. Not in your hair and not on your face. It's not a good idea.
Noted. Okay, not to put this person on blast, but Dr. says to stop washing your arms and legs. There was one commenter that said, that's what every dermatologist I've ever had has told me. Pretty sure it's considered a best practice in dermatology. And before you go on, I don't know about y'all, but when I'm in the shower, every body part is getting touched, okay? Nothing is getting missed, so what's going on?
Okay, this is a concept that comes up every once in a while. I mean, your skin has different types of glands on it. So, your arms and your legs have these glands called Eccrine glands, and when they secrete sweat, it doesn't tend to have much of an odor. So you're fine if you're washing that area every other day.
Okay, so places like maybe your calves or like your thigh. Like
your
neck.
forearms, the front of your legs, things like that. But your groin area and your armpit area has what's called apocrine glands, and they release an oil that can sometimes have a little bit of an odor to it. That's the body odor we smell every once in a while on people.
Okay.
So with that area, you want to be washing it usually every day if you want to practice good hygiene.
There was one other commenter that said, I guess it depends on like what you do during the day and your job.
Yeah, this is true. So, if you're out there working construction or something where you're really sweating a lot and you're getting pretty dirty, you definitely want to clean off your skin. Patients can come in with different bacterial infections on their skin. So, I think good hygiene does help. At the same time, if you're just working from home and not really sweating that much, could showering every other day be fine? Yeah, I think that would be fine advice.
All right, Zach, before we dive into this next one, I'm gonna need us to take a huge deep breath on the count of 3. Ready? 1, 2, 3. Inhale. Exhale.
All right, let me hear the content. I really want to hear this.
Let's do this. Has anyone heard of a dermatologist prescribing a bleach bath? Bleach. So here's the deal. This person is suffering from mild acne, emphasis on mild, and they are also suffering from an unknown armpit rash. So this is why the dermatologist has prescribed them a bleach bath.
Slang term bleach bath sounds aggressive because it sounds like you're putting actual bleach directly on your skin, and we would never want you to do that, or probably cause a lot of irritation.
Okay, so this isn't the bleach that we're putting directly in our laundry, or?
It is the bleach you're using on your laundry, but there's gonna be a very specific recipe to dilute it down, and you would have to speak to your dermatologist in detail about this before trying it.
Okay, y'all heard it here first. Make sure you dilute it.
Yeah, dilute it down.
There is one commenter that did say it works. They said they do it. It's literally no different than chlorine in a pool or bromine in a hot tub.
The nice part is bleach is an antimicrobial, and it might target some fungal things too that could happen on your skin. So, you know, diluting it down and into a bath so it covers a big surface area, like your entire body if you're having a bad body acne breakout. There's a lot of other products I think I would use before a bleach bath. So you have great topicals like benzoyl peroxide, we talked about earlier, salicylic acid. Actually, Curology has the acne body wash with salicylic acid. It's a great thing to cover your body with. You have zinc soap, you have sulfur soap. When I create a list of like 1 to 10 on things I would try first, bleach bath would be at the very bottom.
Okay, got it. You probably won't catch me using it, but good to know that if you do use it, it can work. All right, y'all, that's a wrap. We just ran through a couple different Reddit threads of derms giving some wild advice.
Yep, and so if you want to see Amani grill me again, you know, put some comments in there, give us some likes.
Yes, be sure to like, comment, and subscribe, and we cannot wait to see you guys in our next video.
Yep, we'll see you next time.
Cheers.
Cheers.